Mayo Clinic will soon be out of network for holders of Medicare Advantage plans from UnitedHealthCare and Humana, two of the nation's largest healthcare insurance providers. Mayo Clinic has stated it is already out of network for most Medicare Advantage plans, but does participate in traditional Medicare Parts A, B, and D and Medicare supplement plans. The change will affect patients, especially the elderly, who want to receive health care at Mayo Clinic. In a statement to KTDC, UnitedHealthCare said it had reached an agreement to provide continued access to employer-sponsored plans and Medicare Advantage group retiree plans. Quote, however, starting January 1st, 2026, Mayo Clinic locations in Minnesota, Wisconsin, and Iowa will be out of network for UnitedHealthCare's Medicare Advantage individual and dual special needs plans. Humana stating it to KTDC in part, quote, our partnerships with healthcare providers are central to delivering on this commitment. When providers require significantly higher reimbursement rates compared to original Medicare, it further strains our healthcare system. It goes on to say, ultimately, it costs patients more in the end, as seen in the increasing average Medicare Advantage premiums in Minnesota. Mayo and UnitedHealthCare encourage Medicare Advantage plan holders to examine their options before enrolling for insurance for the upcoming year during the Medicare open enrollment period. The announcement has already made waves up in St. Paul. DFL State Senator Liz Bolden said in an interview with KTDC yesterday she spent her weekend working through the changes with her parents with some difficulty.
I work in healthcare. I've got access to resources. It was, it took some time for me to navigate that system. And so I think about what that looks like for other people who don't have the resources or the background that I have. It is confusing. It is difficult. So it's definitely concerning because everybody deserves that care.
Open enrollment for Medicare plans ends on December 7th. State Senate Democrats are not the only ones sharing their thoughts on the matter. Republican Senator Carla Nelson of Rochester also concerned about the change, though she also notes it's often the cost of health care driving the decisions. She points to decisions made at the legislative level that she says increases the cost of health care for Minnesotans.
It's the cost of health care that is driving these decisions. The cost of health care, the reimbursement rates, or in this case, the low reimbursement rates that don't cover the cost of care. And then how are those costs shifted elsewhere? I hope that they'll continue to look at how we can best make sure that Minnesotans, particularly people right here in this area, have access to really, the world's best health care.
Open enrollment for Medicare plans ends on December 7th.